The postoperative management of patients post-canaloplasty is different than post-trabeculectomy. It's much less intense. I would say in my practice, I see patients post-canaloplasty about a third as often as a typical trabeculectomy. Patients generally have way less discomfort. There is less issues with unscheduled visits post-operatively. Usually it's just management of post-operative eye drops. Now, in my practice, very similar to a typical post-operative uncomplicated phacoemulsification and cataract implant.
The post-operative management with canaloplasty is far easier than with trabeculectomy because you don't have to worry about that window of time where you have scar tissue formation. And you don't have to worry about creating a bleb. So it's much more rapid. I see them day 1, week 1, month 1, and after that you can let them go. At first I had a tendency to want to see them back more often to make sure there was nothing wrong, but I found that for the most part that's not the case. I didn't need to worry about that.
Performing canaloplasty has been really exciting for me. As an ophthalmologist who's been in business now for 20 years, I've dealt with blebs, I've seen them, I've seen the problems. When you examine a patient who's post-canaloplasty, 12 months out and their pressure is 15 and maybe they're on 1 med, maybe 2, but they were certainly much higher before, and you examine that eye and there's no bleb there, you feel like it's magic. It's really so gratifying. And really, it's also so rewarding to see patients do well and see well quickly. If you're a glaucoma doctor, if you're a glaucoma specialist, or if you're a general ophthalmologist who's dealt with glaucoma, then you know what can happen when a bleb procedure goes bad. And it can be weeks of misery, trying to get a wound leak to close or a chamber to form, choroidals to go away. Patients may lose vision for 2 or 3 months. And it is such a stressful event for the patient and the doctor. So the real joy of canaloplasty is I can offer a procedure, get a wonderful effect, and not expose the patient to all those risks. It's just great.
For the post-op management of canaloplasty patients, I treat it the same way as I do with my cataract patients. Initially, when I first started doing this procedure, I would see patients at day 1, 1 week, and I would see it again at 2 weeks and then 1 month. However, I've now scaled back on that, and I see the patient at day 1, 1 week, and then at 1 month. Early on, the first day out, I expect most patients' vision to be down some. If there's a lot of hyphema, the patient's vision may be down significantly. The pressure is usually lower most of the time in the single digits, but I don't get alarmed with that because I've known now through doing many patients in such a short period of time that the pressure will equilibrate and come back up into the low to mid-teens, and the hyphema will go away usually within 1 to 2 weeks. So I don't get alarmed about that anymore.
The nice thing about the postoperative management of canaloplasty patients is that it's very similar to post-cataract surgery. Now, I'm not going to suggest that it's as simple or as straightforward, because there are certain things that you need to look for, that you might need to treat. The occasional Seidel positive patient, patients with a mild hyphema. I mean, these are things that you'll see, and for the most part, you end up not seeing these patients any more frequently than you would with cataract surgery. But it takes a while for the surgeon to get comfortable that these things are going to resolve on their own. Early on, I saw patients far more frequently than I do today. Today, it's pretty much the same as my phacoemulsification cases. 1 day, 1 week, 3, 4 weeks after, and then about 3 months after that. Early on, I was seeing my patients more frequently in the first week or so. But in retrospect, I think I was really treating myself and my own insecurities more than I was treating the patients.